Hello, everyone. On behalf of the Lamb Foundation, it is my pleasure to welcome you all to this evening's Lamposium in your living room Circle of Hope webinar. I'm glad that you all could join us. We have an informative and full agenda for you this evening. My name is Cindy Beasley, and I am the Director of Education and Advocacy at the Lamb Foundation. Now, I also want to give it a shout out. I don't know if he's come in yet, but I also want to give a shout out to Dr. Dan Dilling. He is our Circle of Hope Medical Director, and as always, we appreciate his guidance and his oversight of this program. So, before we get started, I want to take a moment to recognize and thank our generous sponsor, the National Disease Research Interchange, or NDRI. NDRI's partnership with the Lamb Foundation, Lamb researchers, and Lamb patients has pushed forward the science of Lamb through the procurement of tissue at the time of transplant. We appreciate their ongoing support in our research efforts and in our educational programs. So I have just a few housekeeping items to start with. Of course, the microphones will be muted and the chat box is disabled throughout the presentation. At the conclusion of the presentation, we will open the chat box for questions. Also, we are recording this evening's session, so if you do not wish to be visible on the recording, please take a minute now to turn off your camera. Of note is that tonight's presentation is a bit unique in that it will be a presentation and a Q&A session only. To allow for full discussion of this topic with the group, we will not have breakout rooms. So it is now my pleasure to introduce to you Lisa Pascal. Lisa was transplanted at UCSF in 2014 after living with Lamb since 1986. She is the coordinator of our Circle of Hope Transplant Support Program and will be your moderator this evening. So Lisa, you're on mute. Yeah.
There we go. Okay. Thank you, Cindy. So welcome everybody. The Circle of, just a reminder for some of you who've been here a little bit and some of you who are not familiar with the Circle of Hope Transplant Program. It's been designed to support those of us in the Lamb community that are navigating the prospect of lung transplant. Our program offers virtual support meetings, sort of like a social where we can get together and chat about anything we want, educational webinars with experts like the one we're doing here tonight with Bridget Doyle, the dietitian, and one-on-one guidance through peer mentoring, as well, very important, tissue donation education. If you would like to be part of, there you go. If you would like to be part of the Circle of Hope program, there is a separate participation form to fill out in addition to registering for the Lamb Foundation. And you can find that under going to the Lamb Foundation, go under Find Support and click on the Circle of Hope Transplant Program. Then there's a participation form for you to fill out, and that'll come directly to me. And then you will be on all of our education mailing list for education and support groups, and also in contact with me as well. One thing that I do want to highlight that's part of the Circle of Hope is related to tissue donation. And this is critical for us to donate tissue, and it's critical for our Lamb researchers to do the job that they do to find us treatments and cures. And the information to donate tissue is also on the Hope webpage, and it's managed by a company, National Disease Research Interchange. You can contact them directly. You can contact me about questions and we can get you going. It's really never too early to consent for tissue donation, even before you're listed for transplant, even before you're even thinking about transplant. It's okay to get this done and out of the way before life becomes really busy for you. And we're going to get started with a very fun and exciting discussion tonight, Optimizing Nutrition in Lung Transplant, a step-by-step guide for pre- and post-transplant recipients. Bridget Doyle is a master's level registered dietitian. She's been in the business since 2014, and she's been a proud member of the Loyola Lung Transplant team since 2017. She also works alongside our Circle of Hope director, Dan Dilling, who Cindy gave a shout out to earlier. She has presented both locally and nationally on nutrition management in advanced lung disease and lung transplantation. She enjoys helping patients optimize their nutrition through the transplant process and really values the need for individualized care plans based on your pre-existing conditions, your personal goals, your cultural preferences, your overall support. And that's a very key part to nutritional care, is making it an individualized plan for everybody. Outside of the hospital, she stays busy with her 2-year-old daughter, and she's also got a puppy at home. Got your hands full. And in her small amount of downtime, she does enjoy reading, swimming, checking out new restaurants, and visiting her family. Thank you, Bridget, so much for being here tonight and offering your knowledge and expertise on such an important part of everyone's lung transplant journey. So without further ado, let's have Bridget take it away. And after Bridget's talk, we'll have some Q&A.
Thank you so much for that introduction, Lisa. I just want to confirm that everyone can hear me okay? Yes, okay, thank you. And I apologize because yes, in the background there is the child, a dog, and my in-laws' dog. So if there is noise, I apologize in advance for that. But I just want to thank Lisa, Cindy, the Lamb Foundation for inviting me to talk tonight. And also one of the individuals here who I work with closely over at Loyola for even bringing this opportunity to the table. And so my goal tonight is to really try to do an view of everything we would talk about in nutrition going through the phases of transplant. This is something that we could talk about for days. So I really tried to condense it, but of course at the end, I'm open to all questions that maybe I didn't cover. Okay, and so like I mentioned, really what I'm going to do today is review how nutrition needs change throughout the 3 transplant phases. So we talk about the pre-transplant phase, the acute post-transplant phase, and then the chronic post-transplant phase. We'll talk about medication and supplement interactions that we need to be concerned about. And then a hot topic always is the food safety concerns after transplant. And so to start, so your pulmonologist has discussed lung transplant. Now what? There are things you can do even before you meet with your transplant team to optimize yourself from a nutrition standpoint. I always say the earlier, the better. What we're going to focus on in this phase is weight management, exercise, and then vitamin and supplement use. Okay, so when I talk about advanced lung disease, the definition does vary by disease state. However, generally, it would be defined as your FEV1 or your forced expiratory volume in 1 second being less than 30% on your lung function tests. When we have advanced lung disease, our metabolic rate goes up. And this is really the calories, the energy our body needs to maintain normal day-to-day function, to breathe, for our heart to beat, for our brain to work. And so in someone who doesn't have any lung issues, breathing is about 3% of that metabolic rate. When we do develop some sort of lung disease, it goes up to about 25% of your metabolic rate. And this increase can mean we burn calories faster. It can also lead to muscle loss, including our respiratory muscles. This can also lead to unintentional weight loss, which can be a concern for transplant. And despite this increased metabolic rate, many individuals with advanced lung disease still struggle to lose weight. And outside of just the disease itself, that's just a reality in life. You know, there's a lot that drives our normal body weight, and it can come from genetics, hormones, lifestyle. And so, you know, with lung disease, the problems tend to be certain medication use. So if you're needing frequent steroids, or just not really being able to exercise as much. So as our lungs are not working as well, it tends to be more difficult to breathe, and that can make it a lot harder to exercise. Therefore, I always say the earlier we can get into a healthy weight range before those issues arise, the better. On this slide, you can see one of the criteria for lung transplant, body mass index or BMI. This is pretty much a calculation of height and weight. And there are definitely flaws in its use. If you talk to any dietitian, we will all agree that it's not the best marker of health because it doesn't take into account muscle and fat. However, it is used when evaluating transplant candidacy, partially because studies have shown pretty consistently over the past 20 years a correlation between an individual's BMI and survival after lung transplant, which we'll talk about. And so on this slide, you can see what they consider absolute contraindications. So most centers are probably not going to transplant you if your BMI is less than 16 or over 35. A relative contraindication, meaning most transplant centers are going to definitely consider you, but may encourage getting into a healthier BMI range. And I always tell people the easiest way to figure out your BMI is just Google BMI calculator. Put in your height and weight, it'll give you that answer. So talking about those outcomes with BMI. Studies have shown improvement in survival for those in the healthy and overweight BMI category. So pretty much anywhere from a BMI between 18 and 29. Again, we recognize that it's not just BMI alone, but there is a thought process, especially with obesity, that there's increased inflammation in the body, which can lead to graft dysfunction. I'm going to use that word a few times through this presentation. So graft dysfunction, the graft is that organ, the transplanted organ. So for us, it would be the lung. And then dysfunction is, of course, anything where the lung is not functioning appropriately or as expected. On this slide, you can see some results from various studies, one published in 2014, another in 2016, that show that being underweight or very obese increases the risk of death after transplant almost by double. There is another category here on this slide where it says BMI 25 to 26 at time of listing is associated with lowest risk of death within the first year after transplant. Why I italicized at time of listing, I really want to stress that because I take that result with a grain of salt. A lot of times we might weigh something different at the time of listing and then at the time of transplant. We may have lost some weight, gained some weight. And so it makes it a little harder to say, how much that correlates. However, also just changes in weight can help with your transplant outcomes. One study has shown that every 5 increase in BMI, there was a 40% increased risk of graft dysfunction. On the other end of things, in another study published in 2015, they found that every 1 unit reduction in BMI, so say you were BMI 29 and went down to 28, was associated with a decreased risk of death as well as number of days on the ventilator. And lastly, a large retrospective study done at Duke University over 10 years found that any intentional weight loss pre-transplant, if needed, was associated with improved survival. And so that's why, the BMI topic is a thing in the transplant world based on some of these studies. And then staying strong for transplant. So exercise. One word you may hear when you're going through the transplant process is frailty. There's various definitions of frailty, but to summarize, it's a condition when there's minimal reserve in our body. So it's harder for our body to recover from any even minimal stressors. So I'm sure you can imagine a lung transplant surgery is a major stressor. And you're going to have frailty related to disease, where it gets better if that disease is addressed. And then we have natural age-related frailty that just occurs as we age over time. We know that in general, frailty is associated with adverse events. However, there isn't a standardization across lung transplant programs, or really there hasn't been a study to validate the best way to assess frailty in people who need lung transplants. So each center does use slightly different tools. All we really know and what it comes down to is that the stronger you are going into the transplant, the easier recovery you will have post-transplant. A study published about 7 years ago found that those who were considered frail by whatever assessment they used before the transplant had a lower survival rate at 1 year and 3 years after transplant. And a lot of this comes down to lean muscle mass. Those with higher muscle mass have less time on the ventilator, less need for a tracheostomy, and less days in the ICU after transplant. So really what it comes down to, and what I'm telling you, remain as active as possible. It's really easy to fall into this routine of it being hard to breathe and wanting to just sit. And, I completely, although I can't relate, I completely understand that. Everything becomes a chore. And so I tell people the best thing you can do is just still try to keep up with those day-to-day activities, unloading dishwasher, doing laundry, participating in pulmonary rehab or any sort of, a mild exercise programs. And here I actually did include a link that's from the Lamb Foundation's Living Well with Lamb webpage. And it's a really nice video that demonstrates the benefits of exercise in Lamb. Okay, going on to vitamin supplement use, and I know this can be a hot topic too. There are several supplements that may interact with your drug regimen after transplant. Again, since each person is going to be on slightly different medications, overall, we always stress the importance of consulting with your transplant team, whether it's your pharmacist, your dietitian, your doctor, to discuss any over-the-counter vitamins or supplements you're interested in taking before you take them. And each program may use slightly different regimens after transplant. And so on this slide, I just have some common supplements that I have heard from individuals when I've been working with them, and why they may be a concern after transplant. This is by no means an all-inclusive list. Again, that would be impossible to do. And what it really comes down to is how drugs and these supplements are processed in our body. There's this enzyme group called cytochrome P450, and that's what's responsible for metabolizing drugs both in our intestines and in our liver. And there's certain components in foods or supplements that can either inhibit or induce the activity of this enzyme. So it can cause low or higher levels of immunosuppression drugs that we would use after transplant. One very common, and you'll see this on the next slide, enzyme that is responsible for processing about 40% of medications is called CYP3A4. And this is the enzyme that actually processes sirolimus, which I know many of you are familiar with. Also is the one to metabolize drugs we use after transplant, such as tacrolimus or cyclosporin. And then there's some other enzymes that are important for other drugs. And so talking about food and supplement interactions and medications, I wanted to briefly mention sirolimus, as I know this is a drug that many of you are familiar with. This drug is used to improve pulmonary function and help to reduce chylus infusions. And so as I mentioned on the previous slide, it is metabolized by the CYP3A4. And these are the foods we really need to avoid with this drug. Grapefruit and its juice inhibits the metabolism of sirolimus and causes high blood concentrations of the drugs. And there's still a question whether pomegranate and star fruit have the same effect, as studies have shown it acts similarly, but it may just be acting at the intestinal enzyme and not the liver enzyme. So we don't really know the severity of the effect of that, hence why we generally recommend to avoid it. And then St. John's wort causes sirolimus to lose its effectiveness. And that's one supplement that generally just has lots of interactions with different drugs. Okay, and then the ongoing question. So this is one I just want to throw in here because I know this can be a topic in lamb, or if you're researching lamb and diet, and that's of soy. Does dietary soy act like estrogen enhancing drugs, and does this affect lamb? And so why is this concerned? Soy contains a plant-derived component called phytoestrogens, and that means it has estrogenic activities. Since lamb is considered estrogen-driven disease, there have been questions about the impact of this activity from food itself. I wish I had a good answer for you guys. We really don't know. To date, even when I've been trying to dig through the research, there's really no clinical studies that have been completed in the lamb population. However, there are some studies in individuals with estrogen receptor positive breast cancer. And I recognize that is not the same, but those studies have shown moderate intakes of soy containing products of about 1 to 2 servings a day, which they considered a serving about half a cup, is safe. And it's preferred to get it from whole foods. So getting from like legumes or tofu or edamame over processed sources. There are some health benefits of soy, especially related to heart health. So it's not something we necessarily want to completely take off the table. If you're preparing for transplant and need to gain weight, we often will use nutrition shakes as it's a little less filling than food. Especially if you're feeling really short of breath. Sometimes just the activity of eating can make that breathing feel worse. And so sometimes shakes, although I know they don't taste necessarily the best, are just an easy option. What I tell people, though, is that calories are important. A lot of times we're really, in society focusing on protein. But we need calories. If we're not getting enough calories, the protein you're taking in isn't going to be of much benefit because it's just going to be broken down to be used for energy. And so I tell people if you can find a shake that's at least 200 calories or more, that's going to be ideal. A lot of shakes that are advertised as protein shakes are only about 100, 150 calories. So that's something to take into consideration. If you're interested in avoiding soy protein that are in a lot of these shakes, I put just a few on this slide here where they use other protein sources, a lot of them being more of a vegan or vegetarian drink using pea protein. There's also soy-free bars out there that could be considered as well. I personally haven't tried them, so I can't attest to whether they're good or not. But I'm sure many of you have seen on the market are those RX bars where they advertise it's only, 5 ingredients. It wouldn't be vegan friendly because it has egg in it. But those are nice because they don't have soy and they're 200 calories. Another one out there is called Aloha bars, and then a Go macro bar. Those all have at least 200 calories and like between 10 and 15 grams of protein. And then moving on to the acute post-transplant phase. So when we talk about the acute post-transplant phase, we're generally talking like those first 3 months after a lung transplant. I'm really not going to spend a ton of time on this topic because, again, each transplant center is different and I can't, claim to know what each center does. But I just want to touch on some nutrition related and then gastrointestinal related issues that we may encounter right after transplant. So one of the issues that may occur right after transplant is something called dysphagia. This means difficulty chewing or swallowing. And this can be a concern after transplant because we want to make sure that we're chewing and swallowing liquids and foods correctly so that it's not going into those new lungs. Going into those new lungs increases that risk for infection and something we call rejection after transplant. What we know is that those who are on a ventilator for more than 48 hours do have a higher incidence of silent aspiration. And so we generally recommend, and I know at Loyola where I work, we perform what we call objective swallow tests on everyone who's got a lung transplant. This is a test where they have a camera or they can take pictures of where the food and liquid is going to make sure it's not going into the lungs. And then we also have a speech therapist on board to help out as needed. I always tell people, just like our legs are muscles and need to be worked on, our esophagus is a muscle, that swallowing pipe. And so if that's not being used for several days, it can become weak. And so the speech therapist provides exercise to strengthen that esophagus muscle. Another issue we may run into after transplant is something called gastroparesis. This is pretty much a fancy term that means that food takes longer than normal to move from our stomach into our intestine. And if it sits there for a really long time, it can cause a lot of discomfort, a lot of bloating, feeling full very easily, even if you've just had a few bites of food, reflux, nausea, or even vomiting. Why this happens, there's still some, debates, or, there could be multiple reasons why this happens. But a common suspicion in lung transplant is related to what we call nerve injury during the surgery. So there's various nerves that communicate to different parts of our body to tell our organs to do certain things. One nerve is called the vagal nerve that runs behind the chest cavity towards the stomach. And sometimes because it is such a big, complicated surgery, that could get nicked a little. And so what happens then is we don't have as strong a communication to our stomach to tell it to contract, to start moving food down. And good news about it is usually when we do see that happen with transplant, it usually does get better over time. The negative effect of that is because of the severe symptoms it can cause. It can be hard to get all the nutrition we need right after transplant. It can be really hard to eat enough, get enough protein to heal from the transplant. So sometimes we do need to use a feeding tube where we actually put it below the stomach to get the nutrition in during that time period. Another thing, and I know this is something that probably most of you have heard, is the importance of getting adequate nutrition and adequate protein after transplant. The lack of adequate nutrition in that first month after transplant has been correlated with poor wound healing and something we call wound dehiscence. So that's where this wound, where they did the surgery, actually the stitching, it reopens up from the inside out. And those who don't get enough nutrition are 2 times more likely to get infections at that surgery site. Generally, the goal is to consume about 1.5 grams of protein per weight in kilograms right after transplant. Again, it's going to be individualized to you based on other factors going on. But to calculate that, your weight in kilograms is your weight in pounds divided by 2.2. And so that's, again, a rough target. But I always encourage you to talk to your dietitian about what your personal targets are. And then vitamin and mineral supplements. So there have been limited studies to really understand the role of vitamin and mineral supplements after a lung transplant. The only things we really know is that for some reason, we do see elevated vitamin E and vitamin A levels after transplant, but the reasons remain unknown. Most centers, though, will recommend a calcium supplement of some sort after transplant, as the steroids that you're on after transplant have a negative impact on bone health because they reduce calcium absorption. Another vitamin you may be recommended to take is vitamin D after transplant. That might be just with your calcium or maybe a separate vitamin D supplement. Why do we do this? One study had shown that lung transplant recipients who had chronic low vitamin D levels over the whole first year after transplant experienced more bacterial and fungal infections than those with normal levels. Also, those with low vitamin D levels were had more than 2 times the rate of rejection, what we call acute rejection, compared to those with normal levels. However, on the other side, another study didn't really show that correlation between low vitamin D levels and infection risk, but it did show the same results in terms of the rejection. Okay, now moving on to the chronic post-transplant phase. So here I'm going to touch on some of the long-term concerns we may experience after transplant. And when I say chronic, I usually am talking like 6 months, year after transplant, where we might encounter some of these concerns. And so, let's see if I can turn. Okay. On this slide, you can see multiple chronic complications that are associated with solid organ transplants. So this is all organ transplants. It's not specific to lung. And many of these are related to the immunosuppression medicines that you're on after transplant, but are definitely exacerbated or can be made worse by poor nutrition or an unhealthy lifestyle. So one concern that we do see is weight gain. It's very common for patients in all organ groups to experience weight gain after transplant. In some instances, weight gain is very necessary and is very much encouraged to replete muscle and fat stores that were lost while waiting for transplant. However, we also do see the excessive weight gain past what we would consider a healthy BMI. On average, and I again emphasize average, that's why it's underlined, lung transplant recipients experience a gain about 10% of their weight in the first year after transplant. I have some people who gain a lot more than that. I have some who don't gain any weight. I have some who struggle to gain weight after transplant. So it's going to vary. Excessive weight gain and obesity after transplant can vary from a number of reasons. Again, medication side effects, such as using the prednisone, which can increase appetite. Increased appetite just due to feeling better, even if you're not really on high dose prednisone, just feeling better, being able to breathe. Overeating comfort foods, especially in that healing process, right? When we don't feel good, we tend to go towards comfort foods more. And then there's sometimes this apprehension to exercise because we're worried of hurting the new organ. And that can lead to a more sedentary lifestyle, so you're not burning as many calories. Another major concern we run into after transplant is our bone health. And what we really talk about is bone mineral density. So how dense the bone is, how strong the bone is. And this is already a concern in individuals with LAM because of anti-estrogen treatments that are sometimes used. In general, a hypoestrogenic state is a major determinant of decreased bone mass and increased risk of fractures in women overall. In one study, granted it was done in 2005, so it was about 20 years now, found that, but it had a lot of people, so I thought it was still a good study. It found that 70% of individuals with LAM had an abnormal bone mineral density. So whether it was just weakened bones like osteoporosis or severely weak bones, weakened bones like osteopenia or severely weak bones like osteoporosis. And this decreased bone mineral density can really affect our ability to move, heal, lung function, etc. Additionally, after transplant, the chronic prednisone use will affect our abilities of our body to absorb calcium. And then that means our body may pull calcium from our bones. So it's kind of like a double whammy at that point. And then lastly, another concern that can happen after transplant is something we call steroid-induced diabetes after transplant, or you may hear the term new onset diabetes after transplant. This pretty much means that our bodies has a decreased ability to use insulin effectively. And a lot of times it is driven from medications. The medications, and then you have the stress of the surgery and a history of diabetes makes you more susceptible to this condition after transplant. And across all solid organ transplants, so lung, heart, liver, pancreas, etc., it occurs in about 16% of recipients within the first 3 years after transplant. So what we really focus on is how can we reduce that risk, right? We know you're going to be on these medications. How can we reduce that risk of you developing full diabetes? And so at least at our institution, our transplant dietitians really focus on limiting those simple sugars. So those, juices, sweets, even honey, things like that, that get processed really quickly in our body and cause spikes in our blood sugars, we really want to limit. And then the next step is portion control. And why we stress this so much is because uncontrolled blood sugars are going to lead to other issues such as kidney disease. And that, something we don't need to add on top of being a lung transplant recipient. Okay, next going into food safety after transplant. So after transplant, you're on a complex regimen of anti-rejection or what we call immunosuppression drug therapies that I tell people kind of tell our immune system to chill out or not attack the foreign invader, which would be your new lung, right? Our body doesn't like anything foreign in it. Just like if you get a cold, your body responds to that. And so it's not going to necessarily like the idea of a lung it doesn't recognize inside you. And so we give you these medicines to tell your immune system, like, it's okay, we're not going to attack it. And so it really decreases the synthesis of what we call the immune system cells, T cells, B cells, and then something called the cytokine inflammatory response. And with that, that means that you are considered immune compromised after transplant. And so your risk of getting sick, very sick, is going to be higher if exposed to different pathogens. So in general, we've talked about foodborne illness. And in general, there's over 250 foodborne diseases from bacteria, viruses, and parasites. And 48 million total of the general population, not transplant, get foodborne infections each year. About 3% of those people will end up hospitalized. However, there was a nice study that was published in the American Journal of Transplantation in September 2021, so about 3 years ago, that looked at 4,400 solid organ transplant recipients in Switzerland over 10 years. And the medications they used were the same that we use at Loyola that are pretty much used universally across transplant centers. In this, they found that transplant recipients were about 8 times or more likely to get sick if exposed to some sort of bacteria or virus or parasite in our food. And the incidence of foodborne illness was about 4% in this cohort, in this 4,400 people, with the median time that someone developed foodborne illness being about 1.5 years after transplant. 50% of people who did get foodborne infection required hospitalization and graft failure, so the lung not working anymore. A death occurred in 3.5% of those patients within 30 days of an infection. And so we do take food safety very seriously in the transplant world. And these are some common foodborne pathogens in the US. I have an asterisk next to the 2 that are the most common, Campylobacter and Salmonella. Campylobacter is going to be from contaminated water, raw or unpasteurized milk, or undercooked animal products. And this will cause diarrhea, sometimes bloody, cramping, abdominal pain, and a fever. The tricky thing about foodborne illnesses is a lot of times the onset of symptoms is not right away. Generally, you're going to see the onset for this be about 2 to 5 days after you ate the food. And if this is untreated, it can spread to the bloodstream and cause a life-threatening infection. Salmonella will cause similar symptoms. That usually does appear a little quicker, usually about 12 to 48 hours after eating the contaminated food. But it can become more severe in those with weakened immune systems. And then these ones I want to stress are very much less common, but can cause more severe illness. Botulism is something that you usually will find in items that have not been canned properly. This is a bacteria that produces a nerve toxin that affects our nervous system. It can cause double or blurred vision, slurred speech, difficulty swallowing, and if untreated, it can cause muscle paralysis and death. Listeria, which I know, unfortunately, we've heard a lot more over the past couple of years, outbreak-wise. It will cause general gastrointestinal symptoms, nausea, diarrhea, but it can spread to the nervous system of those who are immune compromised, with symptoms being like stiff neck, confusion, convulsions, and possibly death. And those can be found in like ready-to-eat meats, like hot dogs, deli meats, soft cheeses made from unpasteurized milk, or even like sometimes smoked seafood. E. coli. I think most of us have heard this one before, and that's usually from undercooked animal products, but it can be from contaminated fresh produce as well. And then Vibrio, I don't know, I think I butcher how I say that every single time, but that is from undercooked or raw seafood, and it may lead to blood infection, sepsis, and death who are immune compromised. And so how do we prevent foodborne illness? If you search food safety after solid organ transplant, you'll come across a variety of recommendations from different transplant centers. Recommendations are largely based on a common sense approach and expert consensus, as few studies really have been done. Besides that one mention, I really haven't found many studies on food safety and transplant. Most recommendations are based off booklets developed by the USDA for individuals who are immune compromised. So on the USDA site, there's actually like about 30-page booklet of recommendations for those who are immune compromised. So it includes solid organ transplant, cancer, HIV, pregnancy, and similar. But there are steps to try to reduce that risk of foodborne illness, and we're going to talk about those briefly. So cleaning, right? We all hear it, but washing hands, we can't say enough how important that is. And doing it thoroughly for 20 seconds before and after handling food. Washing cutting boards with dishes, utensils with hot soapy water. I always tell people if you have a dishwasher, that's going to be the best way to ensure it has really been cleaned. We recommend, at least at our institution, to use paper towels for wiping down surfaces. If you do use reusable towels or hand towels, we say 1 or 2 times and then put it in the wash. For produce, this is a very common question I get. The USDA recommends at minimum scrubbing fresh produce under warm running water for at least 20 seconds. However, what we usually advise is actually washing with some sort of acidic liquid, so either lemon juice or white vinegar, mixed with warm water to scrub the produce. Bacteria do not like heat and they do not like acidic environments. And so the idea is that acidity could maybe help to reduce the bacteria exposure. Generally, we say to avoid commercial produce washes. We just don't know the levels of each ingredient then. We don't know the safety. We really don't know the effectiveness. And we advise not using soap or detergent on produce, as this will get absorbed, especially in those more porous types of fruits and vegetables. Separate. So when we say separate, that pretty much means avoid cross-contamination. So separating those like raw meats, eggs, things like that from ready-to-eat items. Place those items on lower shelves in the fridge in case there are any drippings, then it's not falling on something that you were gonna, eat, like strawberries or something like that. We should be washing our hands anytime after contact is made with raw animal products. And then we should definitely be cleaning our surfaces regularly when preparing these items. I always tell people, even if you're certain that no juices from the chicken got on your counter, I don't care. Just wash it to be safe. And then some tips that sometimes help is like having a designated cutting board. So say you have different cutting boards. Okay, the red one's going to be for my raw chicken, raw meat. The green one's going to be my fresh fruits and vegetables. And using a non-porous or plastic one that can be put through the dishwasher is always better than the wood ones for these high-risk foods. Cooking. So your best friend is the meat thermometer, the food thermometer, to measure internal temperatures of food. This chart was taken from the USDA packet that shows the minimum temperatures that ensure that food has been fully cooked to kill bacteria. I always tell people it's important how we check it. So it should be in the thickest part of the chicken or meat, and it shouldn't be touching any bones. To decrease listeria risk, which I know has been more common lately, It's recommended reheat hot dogs and deli meats until steaming hot. And then chilling. When we talk about chilling, really the focus is we want to keep food out of this temperature danger zone. This temperature danger zone is 40 to 140 degrees Fahrenheit. And that's where bacteria is going to thrive. So that's why we recommend, our refrigerator should be under 40 degrees Fahrenheit and below 0 degrees Fahrenheit for the freezer. Refrigerate all perishables within 2 hours of cooking or purchasing. Honestly, I even feel like that's kind of liberal. I'd say the sooner the better. And then it's recommended to thaw frozen foods in the refrigerator in cold water in the microwave, not on the counter or in the sink. This is just a brief overview of how long food is good for in the fridge generally. For the freezer, we do have longer, what we call shelf lives that they're good for. Generally in the freezer, meat, chicken is going to be good for about 6 to 9 months in the freezer. Seafood, we'd say within 2 to 3 months, and then leftovers could be good for a couple of months in the freezer. And then being a smart shopper. And so these are little tips when you're at the store, what's going to be a little safer versus not. For dairy and juice products, we say look for that word pasteurized. Pasteurization means it's gone through a high heat treatment to kill any pathogens. Purchase produce that's not bruised or dented. Avoid buying those canned goods that have dents or cracks in them. And understanding dates on packaging. So I always like to stress that dates on packaging do not tell us if the food's safe or not. So like the sell by date is how long the store should display it for sales, simply for like an inventory management, like turnover rate. Best if used by date is when the product is at its best flavor and quality, not a purchase by or safety date. And then the use by date is the last date the product is at its peak quality per the manufacturer. So not the last date it's safe, just at its peak quality. This is a chart we give individuals at Loyola who've undergone transplant. Remember, each center is different, but this we focus on what we consider lower risk versus higher risk foods in each of those food groups there. Just giving a moment for people to look at it. And I, of course, after this, I'm more than willing to share any of this information. Okay, and then staying up to date on food safety and recalls. So there are ways you can stay up to date. I mean, nowadays, a lot of people have social media platforms and you can get updates that way. But you can subscribe for email alerts too through the CDC or the USDA. You can have those sent directly to you. And that's all I have. So I really appreciate your time, your listening, and I hope some of this was helpful. And I look forward to hearing some questions you guys have and discussing more about nutrition and transplant.
There we go.
There you go.
Okay, Bridget, sorry about that. I was having trouble with my mouse. Thank you. That was so much information to soak in and super useful. I think right now we're going to open up the chat box and you guys can type in any questions you want. I've also got some questions that were pre-submitted that we'll start with. And we'll get this discussion going. Okay, chat box is now open. So there you go. Okay, so you did cover food safety very well. Food safety very well. And there were some questions that maybe we can just do a little more specifics. Like one person wrote me was very concerned about eating out in a restaurant particular. And like, can I have, hamburgers and French fries and can I have a deli sandwich at a restaurant? So these sort of things. Do you have any particular tips or suggestions, advice for those of us that need to be really careful about our food safety, but want to go out to restaurants and eat?
Yes, I do. And, This is the hardest part, I think, is that I wish I had a list of like black and white, like what's safe and not. Um, and that's, I wish I could give that to you guys for more guidance. There are a lot of gray areas, and unfortunately, I a lot of times have to tell people, you're going to have to use your best judgment. My recommendations are choosing when you go out, choosing things that are cooked. Heat again kills. And of course, if you're having a burger or steak, anything like that, we say to ask for it to be medium well to well done. Um, in terms of deli meats, I believe was one part of that question. As I mentioned, at this point, we do recommend reheating deli meats. I'll be honest, I think my transplant center was probably one of the more liberal ones on this, where up till like 2021 or 2022, we were saying, you can reheat deli meats. It's going to be safer, but you don't necessarily have to, because before that point, we really hadn't had any listeria outbreaks with deli meats since about 2011. But since that point, we've seen it several times, and so I do advise reheating that deli meat. So I think at a restaurant, that's going to be something you'd be safer just avoiding. I'm sorry, what was the other? Just were like fruits and vegetables or?
Yeah, no, it was just like tips on when you are trying to eat out. So like for
Okay.
fruits and vegetables, maybe if you're not sure how the salad's washed, maybe you choose something else rather than a fresh salad. Or does it also depend maybe how far out of transplant you are? Like, is there any nuances to that, or is it straight across the board for everybody?
Yeah, that's an interesting point too, right? So as that one study had shown, it was about 1.5 years after transplant when was more common to get the foodborne illness. And, my suspicion, not saying this is right, this is my hypothesis, is that because we become more lax? Like, do we become more relaxed? After we get to that 1 year mark after transplant, like we did it. We got to that 1 year mark. I don't know. That's just one of my hypotheses there. Your immunosuppression medications are more stable, after that 1 year mark. You're generally not on as high doses. But I can't say, and I don't think anyone can say if your risk is lower at that point. Most of these recommendations, we recommend like a lifelong. Personally, at Loyola, we actually don't recommend getting any sort of lettuce or salads at restaurants. We consider it a very high risk food.
Okay. And a
At
question
home.
just came through about lettuce and tomato on a hamburger, which
Mhm.
would sort of fall right under that.
Yep. So we say no lettuce at all at restaurants. We just unfortunately have seen so many outbreaks with E. coli in our environment that I don't think it's worth the risk. And I actually, if you don't mind, I want to share one thing that a couple of transplant patients put together for some tips with eating out, if that's okay. I have it pulled up here.
Yeah. Please share. And maybe this is something you can share with me and I can email it out to everybody.
So there's an actual handout that I'll send to Lisa that could send out. I just pulled from this handout, but this was made from two people who've undergone transplants, and then along with myself and another dietitian over at Cleveland. We put together just a one-page tips, but we really respect the individuals' experience who've gone through transplant, because again, you're the ones dealing with it day to day. And I always say part of transplant, right, is to enjoy life. And I think food is a very big factor of that. So we want you to go out. We want to enjoy these things. We recommend, of course, using hand hygiene, trying to use like individual condiments instead of the shared condiments that can be at restaurants, being confident enough to ask your server, about the meats, the chicken, unpasteurized cheese. And if you're not sure, if you feel like the server's not sure, asking if you can speak to the cook. Of course, the meat should be medium well to well done. And if you have leftovers, you should get them into the refrigerator as soon as possible. There's also some recommendations for events with buffets. You're going to have those in life, whether it's weddings, corporate events, conferences. And so these were just some tips from people who've experienced it on what to do.
Yeah, a buffet could be tricky.
Hmm.
Okay. That could be really tricky. So those are some good tips. I'd love to share those.
Yeah, I'll send you the actual handout, the PDF that was put together.
That'd be terrific. I did also, before I also go to the questions in the chat, I've had two extreme ends of questions about gaining weight before transplant and then the sort of body dysmorphia that comes with the gaining weight after transplant. Like it seems like there's a lot more fat gain and that's going in places that we're not generally happy with necessarily.
Mhm.
So let's start with the pre first. And there's definitely eating issues ahead of time before transplant, pre-transplant, early satiety. So feeling full quickly, how to deal with that. If you're just you're just not hungry, you don't even have the
Yeah.
appetite,
Oh,
right? And you're breathing so hard, your respiratory rate is high, and it's hard to eat and breathe at the same time. So and there's the tips out there. They like people are aware, like, oh yeah, I know I'm supposed to eat high calorie foods like nuts
yeah.
and avocados, but I just am not feeling hungry or I get too full. Do you have any suggestions on how to work through that situation, getting in enough calories
It's
while
really
you're having a
difficult.
lot of difficulty
Yeah, it's
symptoms?
really difficult. It's easy to say one thing, it's hard to do, right? And so of course, I personally want to work with each person to see what might be practical. That's why we do, again, depend on those shakes. Sometimes some people are just like, even if I don't have an appetite, I can try to sip this down and get those calories in throughout the day. Or maybe I'll say, okay, instead of water with your medicines, do half the shake with your morning medicines and half the shake with your evening medicines, getting the most bang for your buck. There's things we can use. Some programs will use appetite stimulant medications to see if that can help with the appetite a little bit more. I've had, both positive and kind of not negative, but not really positive effects from that. Sometimes we can use medications to help with satiety, but again, I don't always love just throwing more medications at a pile of medications. And so it can be hard. I mean, honestly, the last resort is feeding tube. No one wants to hear it. No one wants it. But if that's a barrier to transplant, and that's going to be a barrier to your recovery after transplant, is your weight and your strength. Um, my attitude is just got to do it. We got to do it.
Mhm.
And so, if we're really struggling, that's something we need to discuss. I think that's something that's important to be done earlier than later, to really try to get that weight on.
Mhm. Yeah, and you did your slide where you showed that your weight need your BMI. You mentioned BMI, but that correlates your weight. It needs to be your BMI needs to be within certain points. So I guess if you're going too low and you're saying just get it done with this feeding tube, right? Nobody wants to hear that. But if you want to have a better outcome of the transplant, then you want your weight up at a certain
Exactly.
BMI.
And it's like, you don't want to wait either. You don't want to keep being like, let's see if I can stop the weight loss. Let's see,
Mhm.
because you're getting sicker. Your
Yeah.
need for transplant is increasing. And we have this window. We always say there's this window. And we need to get you in a good spot for that transplant when you need the transplant.
Right. And I liked your guide. You said about 200 calories worth of a shake or a bar. What about the protein powders? I get questions on those. What do you
That's a
think
great question.
about those for adding in calories, protein, etc.?
They're fine. Um, my holdup is a lot of them are low calorie and high protein. So they're giving you 30 grams of extra protein, but they're maybe adding 70 calories to your food. So again, unless we're taking that protein powder and mixing it with calorie dense fluids, whole milk or oat milk, blending it with peanut butter, something like that to get the calories with it, I just don't want people to really waste their money, honestly. I want you to get what's going to be the most benefit for you, because none of these things are cheap.
Right. Well, pre-transplant, do you know, does insurance cover some of the drinks? Like if someone wanted to drink Boost or Orgain or Kate Farms, like you had some of those listed on your chart. Are those covered by insurance, or are you buying those over the counter at the supermarket or a store?
So my experience has been, so I do all the prescribing or like sending the orders for those types of things. My experience generally is that Medicare is the strictest. Medicare, it's really difficult to get any coverage for nutrition shakes. Some private insurances, we get it. That's, again, going to be difficult. And then the Medicaid aspect is going to depend on what state you live in. Illinois, Medicaid's really good when it comes to coverage for nutrition shakes. But again, that's so individualized, it's hard to say. I always say if you have private insurance, there's no harm in your physician sending a prescription and seeing if it gets covered.
If it gets covered. Okay.
Yeah, it's not going to hurt.
Excellent. And there was a question about, is the sugar content okay pre-transplant in some of those shakes? Does that need to be a concern at that point? Because you mentioned sugar after when we're on prednisone, which makes sense. But what about before? Is that okay for calories?
So that's a great question. I think everyone's going to have a slightly different belief in this. Of course, I always want to get the most nutritious product if I can. And that's why I do like some of those products I even mentioned, because they're generally more whole food based. So like real foods, like even using agave for sugar and things like that instead of processed sugar. But overall, if we just need to get the calories in and we're at that point, we need a transplant, then drinking like a booster ensure that might have more of those added sugars is fine. If that's what you tolerate or that's what you can afford, that's better than nothing. It's not going to, for that short time that you're using those to keep on or get weight, it's not going to have detrimental effects to your health.
Great. Thank you.
That's at least my personal philosophy as a dietitian. Sure. I can't speak for all dietitians across the country.
No, you're our expert here tonight. So we're listening to your opinions. So looking at that weight, so the pre-transplant, but then you go to the post-transplant. And as you mentioned, it is easier to gain weight of the medications and appetite increasing. It seems like some of that weight, a person was concerned that it seemed like that weight was a sort of preferential gain of body fat in places that weren't really welcome. Do you have information on that? Is there some way to work with that issue, change that trajectory?
That's a hard question. It is. We tend to gain more fat mass after transplant, and a lot of it is medication related, especially that lovely prednisone. A lot of people, they describe the moon face and things like that they get with prednisone. And it's really hard. I mean, the only thing we can control, right? There's factors we can't control. And, that's hard to accept, right? We can't control how that medication is affecting our body if it's keeping our lungs healthy. But all we can do is really try to live our healthiest lifestyle, exercising, choosing whole foods as much as we can, limiting processed foods. That's the only thing we can do to have some sort of control in that. If there's significant weight gain, significant concerns for unhealthy weight gain, of course, that's always a different pathway long-term after transplant. Once you've really recovered a year, 2 years after transplant, that you should discuss with your doctor. Are there options for you? Now some of those medications that are used to help with kind of some of that weight loss, is that feasible? Those are discussions you should have with your doctor. I wish I could give a magic pill or solution to that, but I can't.
Right, right. No, I appreciate you giving us your best answer. I have another question that came in about somebody who's on a vegan diet, pre-transplant. And are there any special like things that supplements or maybe more protein powders or nutrition drinks or something to meet this higher protein need that you're talking about? Have you worked with someone on a vegan diet, and how does that look for somebody?
Yeah.
'Cause
It can be, it's hard, challenging, right?
yeah, okay.
Yeah. I'm sure, I hope most people probably have heard the vegan diet, and that can be really challenging because you're eliminating a lot of those high protein sources, those animal proteins, eggs, dairy. Um, and so protein's a concern. Other concern, nutrient deficiencies are a concern in that population, especially vitamin B12, iron. Um, and so I do think it's something I appreciate when someone who is practicing veganism, that they're aware and they're paying attention to their nutrition. I always say that in general, we should make sure we have those levels checked, especially that vitamin B12, the iron, the folate levels, make sure that we are monitoring those to make sure you're getting enough of those nutrients. In terms of protein, of course, you can try to get protein through plant-based sources, beans, legumes, some of those whole grains like quinoa, lentils, and then nuts. If you do need, if we do feel like we need some additional protein supplementation, that's when I would resort to like the Kate Farms or the Orgain vegan shakes to get that calories and protein. Or you could also use a pea protein powder just to meet your protein needs. I would say the pea protein powders are probably the most popular on the market for people who are vegan. And you could use that to add it to a drink or just mix it with water.
Okay. So it's being very aware of
It
what
is.
your intake is. You have to think about it almost a lot more to make sure you get your protein and those vitamin mineral levels that you mentioned, iron and B vitamins. You have to be very careful and cognizant of meeting
Yes.
those needs.
And I would hope, again, if you're at that point when you're working with a dietitian, that they're able to guide you on that. Like that's something that they should be able to provide that guidance on. But just, yeah, preliminary, if you are vegan, like I almost always, you're going to need the vitamin B12, even a multivitamin supplement, things like that. And that does bring me to, I did want to bring this up too, because a lot of times people are thinking about like, what else can I do for my lungs, right? What else can I do to prevent the progression of the disease? Are there things I can take besides just the medication? And so there are things on the market kind of advertised as lung health or lung detox supplements. And this falls into that category when we talk about vitamin and supplements, right? And medication interactions. Again, before you take anything, just run a quick check with your doctor, or if you have a pharmacist or dietitian that you can talk to, right? We just don't want you to ever take something that's going to risk a negative effect on your health or your medications. These are just a few popular ones that I've heard of from people. And I pulled some of the common herbal supplements that are in these lung supplements, but again, they have so many. A lot of them have like 10 plus ingredients in them, and I didn't go into all of them in detail. Some of the ones I didn't mention on here either just don't really have any research on them, so we can't say what the effects are, or when I looked at them, they were pretty safe. Like I wasn't very concerned about them in interactions. This Mullen's a really common one, advertised for keeping our lungs healthy. There's like no research on it, unfortunately, but promising. There's been no toxicities reported either. No studies have been done to assess drug interactions, though. This hawthorn, I do like to point out because there was recently a warning about it. So the FDA issued a warning to avoid supplements with Mexican hawthorn root because they may be adulterated with this toxic yellow oleander. Again, I might not be saying that right. which
Oleander, it's a plant. Yeah.
yeah, oleander, thank you. This can lead to GI, neurological, and cardiovascular adverse events could be severe or fatal. So like the one supplement, the Mighty Lungs one had this in it. And it was interesting because when I went to their site and tried to figure out where the hawthorn root came from, it says this supplement's made in the US, which is great, but it said that ingredients are obtained globally. And that's all I could find. So I don't know where globally it came from. It does have interactions with some heart medications too. The other two too, you can see, especially the Schisandra, that one has interactions with those CYP384 substrates, like the sirolimus and tacro. And then some supplements have like these estrogenic effects too. So I'm so in my philosophy as I never just say no, but I think it's just really important to have the open discussion, especially if you're trying to find things to optimize your lung health more naturally, not with just medication.
Mm-hmm.
Sorry, that was a long-winded answer for the question.
No, I feel like that slide is actually like a cautionary slide in a way. Like people might come, it might sound great. Let's take these supplements and really increase our lung health. But what you just provided, things that don't have research, things that toxicity levels interferes with your sirolimus, your tacrolimus, that's like a cautionary slide to me.
Right.
And I feel like backing up from that is looking at like what you're just talking about to us is look at your diet, increasing your diet, making sure you're getting enough calories, enough protein, enough of the basic nutrients first, and then
right before we add things.
Before we add anything else.
But I definitely respect wanting to, find whatever, right? That's what we want.
Sure.
We want to find whatever we can to help, right?
We do. And I'm glad you put that up there though, because we also want to reduce harm. So now we know the one you showed, was it Shashandra with the interferes with sirolimus and tacrolimus, but we don't want to mess with that because we know we have research on sirolimus that it has shown to slow down the progression of LAM. So we want that. We don't want anything to interfere with it. So that was a great slide. Very interesting. Someone asked about particular diet related to, they heard that wheat can bring a lot of like inflammation to the body, and asking about like a gluten-free type diet, all those kinds of
the different maybe like
approaches to eating that may help lower this inflammation. Is that something that's good for people that are pre-transplant or post-transplant to consider doing?
I think again, the most important thing is you have to look at your individual case, right? And where you are, what you need, what are your nutrition goals. There are foods that tend to be more what we call pro-inflammatory, and then foods that are more anti-inflammatory. Wheat can be controversial. Generally, wheat, as far as we know, is more so going to be pro-inflammatory to those who have an allergy to something in the wheat products. In a general population, actually, the whole wheat products actually have a more heart healthy benefits to us and anti-inflammatory benefit. One diet I personally like a lot, and again, it's not just because it's recommended by all these groups, but really looking at these diets is just the Mediterranean diet that has shown decade after decade to be beneficial for our health. And it's because most components of the Mediterranean diet are anti-inflammatory. So healthy fats, whole grains, it's less processed foods, more whole foods, fruits and vegetables. And so that's one I generally go back to. There's no magic here. No diet's going to I wish I could say that, but no diet's going to prevent LAM progression.
Right.
That we know of at this point. There's no studies that have shown a certain diet that's going to, reduce the effects from LAM.
Mm-hmm. What about there was a question in the chat box going back to the food safety issue, which I think brings up a really good point. What is your opinion of bread or cheese that has some patches of mold on it? Throw the whole thing out or cut off the mold and the rest is okay to eat?
Yeah.
What's your opinion of that one?
I would say in someone who's immune compromised, my recommendation is to throw it out.
The whole thing.
Yes.
So if there's a little mold on one end of the bread, you're saying throw the whole loaf out.
If you are immune compromised, that's what I would recommend. And it's probably a conservative approach, but I also go on the side of better safe than sorry.
Okay.
If you aren't immune compromised, I cut it off personally, but just that one piece.
Okay, so if you're immune compromised, that means more of a sort of after transplant when we're on immune suppressants and the food safety issue. So same with cheese, cut off that mold or throw the whole block away. You
Throw
say
the block away for immune
throw the whole block away. Okay. Okay. Wow. Yeah, that's not something that I've been doing, actually.
I know. And again, that's just my best educated recommendation. We don't have good backup science or resources for it. I'm just going on the edge of better safe than sorry.
Yeah. No, that's
but
lovely to hear.
Most people will probably be fine.
I have just a couple more questions because we're getting close to our end time. There's a person that's about 10 months post-transplant and dealing with some neuropathy. Are there any nutritional interventions that can help ease the symptoms of neuropathy, slow it down?
Yeah. That's a hard question, only because, there's a lot of factors that can go into it. If we talk generally, in general, the nutrients we think of with neuropathy are going to be a lot of our B vitamins, vitamin B1, so there's no harm in getting those levels checked. I always say, if your doctor's agreeable, it's not going to hurt you to get those blood levels checked. There's are unfortunately side effects from our medications too after transplant. The tacrolimus can cause a lot of issues with our nerves, some tingling, some neuropathy, shakiness. And so it's, we have to balance that, right? We know the medication is important, but also your quality of life. And if you're experiencing that neuropathy, can really affect your quality of life. Healthiest diet as possible, more anti-inflammatory diet, right? Like we talked about may help a little, but that's where I would start. I would, ask about getting certain vitamin levels, nutrient levels checked, and just rule that out as a contributor.
Can you tell us like what, I know I've had trouble when I asked in my doctor, can you check my vitamin mineral levels? Like what specifically am I going to ask for or look for?
Yeah.
I don't know what labs necessarily are out there.
Yeah. Yeah. So I kind of start with what I consider like my basic labs. And it, again, also depends what your institution's able to test too. That can be a factor, but I like to look at the vitamin B1, vitamin B3, if they can test that. We don't have that at my institution. I like folate, vitamin B12, zinc, copper, and then our iron. We kind of say our iron panel, those levels, just make sure there's no anemia that's playing a role in this. That's where I personally start. And that's usually where I really focus on those B vitamins.
Okay. And those we can ask for in our labs. We can ask them to
ask
our B vitamins. Okay.
Yes. I don't know what the responses are going to be, but you can definitely ask.
Yes, we can definitely ask.
There's no harm in asking.
True. What about magnesium and different medications that we take post-transplant? Is there a need to take extra magnesium? Is it often in competition with some of our meds or?
Magnesium's tricky.
Magnesium.
People who have had a transplant have probably, not everyone, but have probably had issues with low magnesium levels at some point after their transplant or chronically.
Mm.
One of the medications, and there's a few out there, but one you guys have heard tonight, tacrolimus. In very simple terms, what I tell people is that tacrolimus likes to tell our kidneys, hold on to all the potassium and get rid of all the magnesium. And so we do see low magnesium levels. It's very common to need magnesium supplementation after transplant. Magnesium supplementation, in my opinion, can be really hard though. It can be really hard on our guts. Some people have a hard time tolerating it, and how well it's absorbed can vary by person and also by the form of magnesium it is. And so I've even had some people who just need to go for like IV magnesium infusions to keep their levels at a happy spot, which I know isn't ideal either, but it is a chronic issue that we do see after transplant.
Okay, so maybe people could talk to the dietitian at their center if they're having trouble with their magnesium and finding a good type of magnesium supplement that's out there, because there are many.
There's so many, or the pharmacist.
Pharmacist.
There's definitely some that are what we consider more bioavailable, may absorb a little bit better. People ask me about food a lot too. And of course, we can try to optimize our magnesium intake in food. It just can be really challenging. A lot of times the amount that is in food is just not going to be enough to bring those levels to normal.
Right. Okay, so this has been a very interesting discussion. I hope that everybody's gotten their questions answered, and we are definitely out of time. Time flies when you're talking about nutrition, right? So, Bridget, I really want to thank you for coming tonight and enlightening us all on all these aspects of nutrition and taking the time to discuss with us the importance of our health during our transplant journey. And I want to thank each and every one of you also for joining us tonight and for participating in our conversation. We're going to have a recording of tonight's webinar. Will be probably released in about a week or two, and it will be on the Circle of Hope web page within the Lamb Foundation's website. And I'll be sending let's see. No, I know what I want to tell you. I'm sorry. We're having another social in December, and this is where we like to get together and support one another and come together and get to know each other within our Lamb community. And so if you want to get on that email list, it's going to be in December. If you want to get on that email list, please send me an email and let me know you want to receive an invite for the social. I usually do them about 3-4 times a year. And it's a great way just to get to know our fellow Lammies who are thinking about transplant or who have gone through transplants. Great way for all of us to learn together. And again, Bridget, thank you. Everybody, be well. Have a nice night, and we'll be in touch soon. Thank you.
Thank you.